So I just shoot the video about the sleeping stuff in the neck because everyone come in the morning and say, oh, I think I let the window open and the wind is come and just like spasm my muscles. It's not true. You see how she's sleeping? Her head is this position, like in an angle. So I am, and also when we sleep on the side, you see this side is collapsing this way. So she got twist. So what happened to the spine? Laura.
Yes, yes.
So when you sleep like that, I'm just gonna show this way. You see the spine? Come up here, Veronica. So you see this, what happening? So this is how your neck tilted. So one side has become really spasming and another weak. And also we have that vertebra is open up. Now, if she's sleeping this way, just think about it. She's twisting this way, right? So because she dropped this way. So her leg is make that spine twist. So what happened here, you see this open up all this space. And that's really painful. When people get up and it's not locked properly, that's caused a lot of pain. So before you get up, you have to do some specific movements and exercise, but this is not the topic. So your pillow is always have to be in level. Your nose have to be in line of your chest. It's not. So you see the head is tilted here, yes. And if people say, oh, I have the small pillow, I have a big pillow. Big pillow even gets some more like this. And that's a side position sleeper. Next one, it's no pillow up here, right? Because your hips start tilting to also forward, and that's create that lumbar area and sacrum. So just think about it. If it's come this way, always twist, right? That ilium, it's open up that SI, and it's always problem for your L4, L5. Okay, that's what's happening. That's little boom boom jelly stuff coming out. Okay. So side sleep position, you need to put the pillow up here or a towel under your rib cage because you also have the rib cage is dropping here. You see what's happening? Like this. Yeah, this way. So need to put some stuff up here and pillow here, and of course something up here or someone. Okay.
1, 2, 3,
Yeah.
4. Taking 4 pillow.
Yeah. So you have to grab someone and not collapsing forward. If you're collapsing forward, that's create a twist in your spine, and that's not good. So the neck, yeah, that's why she feel it. Now you're gonna get up and we're gonna do assessment. She's sleeping, and now we have to just do postural assessment and movement assessment. Where's the pain? So can you describe your pain?
It's coming from here to my scapula.
And scapula. Okay. So you sleep on this side.
Yeah.
So that's mean she always overstretched this side, and this side is jammed. So remember this donut part? When you push in one side, the jellies come from another side. So if she's sleeping this way, the pain is gonna be on that side. Okay? All right, so now we're gonna do postural assessment. So Veronica, you wanna do it? Let's do eyes and shoulders. So let's just see for
So
eye.
one side is higher than left
Okay.
side.
I just place it on the coracoid, on the top, right in there. Yeah. Hold on, right here.
And then also the left side too is also higher.
Left side.
And then, but the right side is actually a little bit forward.
Mm-hmm.
So she has like a little bit of rotation there.
And she's
Oh
doing.
wow.
And she's doing also hips on those PSIS.
Right. So yeah, also the left side is higher, and the other one is much dropped like a lot.
So this is some compensation.
Yeah.
It's too much?
Yeah. So what?
Oh my God.
This is great. You're doing good. She's standing now. Now let's ask her to sit down. Let's just go ahead and sit down. If change anything in her shoulders. Remember, we always do sitting position and standing position.
A little bit.
Change? Okay, so you
It's
see,
not as rotated the right side.
so that's mean when we take the gravity from the hip, it's changing upper body. So we have a compensation. So basically, we need to work on the lower body to correct the upper body today. But if this is only neck, I mean, we case neck, we're just gonna work on the neck. Remember this Bergen test? You come up here in occipital and they ask you to stand up, and you see where is the most tension on the side. Remember this one, an occipital? Okay.
Save that one.
Okay, that's okay. So you put an occipital ridge, you put it right in here. Where's my spine? So what we do in here, we just place it right here on those muscles, and when she sit down, it's gonna change the tone. If the tone doesn't change, that's mean she don't. She's only problem in the neck, not in the hip. So sometimes she sit down, it's problem in the hip and in the neck. So go ahead. I'm gonna hold it right here. Go ahead and sit down. Sit down, just in the back. And get up. Yeah. So I can really feel it. Go ahead and try
It's
it.
moving?
Yeah, it just get tone. Yeah, you can step on this side. So hold it, just like, and ask you to sit down. And you're gonna feel it. If you don't feel it, that's okay. You're just practicing. So do you feel?
Good. It relaxes just a little bit more, but not so much.
Yeah,
It's
so
still kind of.
This is all practicing, and this is. So remember, when we start sitting down, our spine is we lean one side to another, right? And it's change everything. Let me show that on the spine. So this is what's going on. Let's say you have a normal curve of the spine. Let me go back this. It's actually what this clicking is. There we go, a lot of adjustment. So when people, they sit down and they start leaning one side to another, right? So what's happening? Let's say I'm sitting this way. So let's create the curve, right? So you put one side to another. And it's open up and start twisting this way, and it's get compensation because your brain, they want to sit straight. They think they sit straight, but it's not. So I'm usually doing this. Watch me. So I'm sitting here and I'm doing this. You see what I'm doing? My spine is going this way. So I create a lot of tension up here, and I'm always gonna feel pain up here. Because why? I'm open this up. This muscles get contract, and they push this gel outside. So basically I have this on my left side, and I always feel on my left side. And what we start doing, we start treat the left side.
This side, yeah?
Yeah, but the problem is on the right
Right
side
side.
because I'm doing this. You see? So I'm
Right.
lean, and I'm always sit on
And
this
that's part
glute.
stretched.
Yeah. So what I will do, I will put some probably book up here under my glute, and it's gonna kind of correct it. So I always try to sit like straight and kind of pull myself up. That's the idea. Okay. So neck. Go back to the neck. So what we find out, the right shoulder is rotated forward, left shoulder is high, and let me just do it. No, just relax, let it go. Which eye you said? Left one, right. So left one is a little bit higher. That means she's kind of like this all the time, right?
Right.
Right? And that's how she sleep. She sleep on this side, so you see?
Right.
Yeah, so she's so upset now. That's okay. Okay, there we go. So we look at the shoulders. Yes, this shoulder is high. So that means she lean opposite side. She's kind of like me. Yeah, she's gem on this side. It's going to be a lot of tension on this side, on the right side. Okay, and she have scoliosis. She have a different case. All right.
Actually, I think the left side is the one that's rotated a little bit more too.
Now we're gonna ask you to turn around. No, like turn.
Oh.
And we'll see what's the midline. Is that she's any head forward posture or not? She's not that bad actually.
No.
Her shoulders will.
Yeah, she's not bad. She a little bit, you see, you can see this, but the head, look, she's kind of like this. You see, she's kind of like, yeah, she have a pain in her head. Yeah, that's not good. So if you guys have a pain with the neck, come to us. We're gonna help you out. So let's start treatment then, because we see what's happening. You sleep on the left side, right?
Yeah.
Okay,
It's
so
left, right, but
yeah,
now
everything is jammed on the right side. So we need to release that right side to help this left side. And we're gonna do with the CBD, with a specific gel. So go ahead, lay down, face up. You don't need to undress. If people need a pillow, is that you feel comfortable lay down like this?
Yeah.
You
I'm
okay?
okay, yeah.
All right. So usually I put the pillow, and let's stop this down. All right. So how I start the neck? I am never. If people come with the pain, I'm never like do any strong manipulation and movements. I don't want to. You remove the chain? Okay, perfect. So usually, yeah, I check the testing, but she's in pain already. We don't want to provoke more pain. She's already in pain. So I grab, like right in here, I put the 2 thumbs right in scallions, and what I'm just do a little traction up here. Traction, just a light traction. Some people do traction with placing on the forehead, and just like that, it's also good. If this is the big guy, and if this is the big guy, you use always towel. So you can use the towel like that. You grab and kind of put on the jaw, right in this. It's the masseter, and you just kind of. How's it feel?
Good.
You can do a little shaky like this to the side, but not bending, not side bending. A lot of people do side bending, don't do side bending. And this is you can do. Also, you can put around, and this is really powerful, but you don't pull so hard, okay? You just come like this and gently pull. You see, I'm grabbing the towel, and it's towel around. Do you feel comfortable?
Yeah.
Okay. I'm not gonna do it.
It looks like you
Yeah, no, I don't want to choke her, so
You wanna kill me?
yeah. And just like that, just gentle.
Cracked?
No,
No, I don't want to do cracked. I mean, if
I have a
cracked,
pain now.
yeah. So this is the compression, okay? Now I want to work on the spasm muscle. So remember, we have spasm on the right side because she's asleep. Yeah, on the left side. Here we go. So sternocleidomastoid. You guys know how to do that? Yeah, you turn to the right. You grab the sternocleidomastoid and you just start stretching. Not the stretching, you're pulling all the way up. And I feel how spasm this muscle. You want to try it? Go ahead, touch this muscle. Come on, try this. Grab it. You see how spasmy she is?
Oh!
Yeah. So
You push a lot.
yeah, that's okay. It's a trigger point. So she have a trigger point.
Oh.
So I bend to the side and a squeeze. Okay. I'm doing this then. So let me just show you a couple of things and Veronica is gonna help. Yeah, it's right in here. You can feel it.
The trigger point.
Yeah, you can feel it right there. Watch. Right there. Yeah, you feel that? Yeah. So that's might be the one she feel that pain and trigger point. But we also want to get that neck back on track. So we not do adjustment, we're not chiropractor, but what we can do, we can really manipulate that cervical area.
I got stressed. I have to sleep.
Can you turn the camera off? You still have a lot. So, yep, and I work on the both side. Even this one is overstretched and I can feel it. Come on here, Veronica. So you can feel this left side and right. You feel the difference between left and right, how tight it is, how spasm the right side.
Mm-hmm.
So yeah, we need to really work on the right.
See that touch
Mhm.
right here too.
And what we need to do end of the session, we need to activate those muscles because they're weak, so they're not working properly. So now I can work on the cervical groove, laminum groove. So basically what I'm doing here, I'm just get that spine and I'm traction and laminum groove. So just like that. And now I've become a little bit on the side. Come on here, just get your hands on there and you feel on this, do some little traction up here. You feel this on the left side, like a big bump?
Yeah.
So that's because you remember, she leaned on her right side like this?
Right.
Yes, so this vertebra is
Be sticking out, right.
sticking out. So you can do a sitting assessment, but I think when people lay down face up, it's really easy to find out. And like I said, we're not chiropractor, but we can do a little light manipulation and get this back to normal. So yeah, so I do a little traction. I find that little bump, which is
And you can feel that vertebrae like shifted to the
yeah,
left.
exactly. And the cool stuff is they like brother and sister. They're always together. If one vertebra shifted, the another vertebra shifted. If C2 shifted, C3 is going to be shifted too, and that's what's happening. So I am kind of little work on the side, like I said, small movements. Now, so she have pain, a lot of pain. We'll see what we can do for her with this neck. And like I said, if we just do massage or manual therapy, she's going to be fine for 3-4 days, but she's going back to her sleeping pattern, and is going to be doing again and again and again. So we're not going to probably change her sleeping pattern because she is...
It's a habit.
It's a habit, yeah. And you fall asleep, you don't control yourself. But what we can really do, we can apply some resistant bands and really restore that muscle before she goes sleep or after she wake up. I will probably suggest do both, and we're gonna show you guys what to do.
You do with your finger?
Yeah, it's my finger. It's not my legs.
No, I mean this part.
No, yeah. he's using
Yeah,
his fingers.
I use my finger pads. Yeah. And so just like gentle stuff. And now, Veronica, you want to try it too? Go ahead. And go ahead, strip that as sternocleidomastoid for me too. Left side, just work a little bit on that too. Go to the left side. To side you want to work on, just really gently, because remember, how do you feel? Do you feel better? You see, she's already feel better, so. We have a great result, like I said. It's, if you guys suffering with the chronic pain, neck chronic pain, yeah, you can be more aggressive. Don't,
Yeah, because I just don't want her to like
no worries.
trying to work
Look,
slow.
do like a hook, yeah, and you grab under. Yeah, don't worry about her. She's gonna be.
I'm
all
worried
right.
about her.
push
I
it.
just want to work with
No,
her.
if people say, oh, yeah, just we're listening. We're always listening. We try to be gentle. Pain, okay, slow down. Yeah. Really nice. How's it feel?
Good.
Okay. So let's see if I do also, this is spasming side. Let me put the camera on this side so people can see exactly what I'm doing here. So I grab the forehead, I place right here, and I come all the way to the other side. So you see my fingers right in here on the other side. So basically, and she liked to lean to the right, right? I ask her to lean to the right, and now turn your head to the right very slowly. And what I'm doing, I pull it, turn to the right. Yes, she's activated this muscle. And I pull up, turn, and let it go, relax. Do it again. Turn to the right. So she turned to the same side and let it go. How's it feel? It feels great. It's good feedback. Let's try it. So you stay right here, always perpendicular to the body. This side.
Okay.
No, this.
Yes,
hand?
exactly. This
Okay.
hand, all the way like digging there. Yes, you got it. So what she's doing here, let me get that. Yeah. No. So you see where's the fingers is? On this side. And what we're doing like a light, she turned to the right, same
More,
side.
more.
Mhm.
Push more this side.
You kind of push. So you just hold it and you just lift it up. And she rotate to the right. Ask her to rotate. Is any pain?
No, no,
Okay.
it's good.
Good. Let me. So come on, place your hands on the top of mine. Let me get your hand. This one. And let's come on the top. Don't be worrying. And this, we ask you to turn your head, and we're doing this. And let it go. You see what are we doing? And see how we change already. Look, she's already look better.
And what about this side?
So when you want to do it on this side?
Yeah, the question is, we do both sides, but we're more focusing on this side. I'm just, people like, oh, why he did on that side and nothing did on this side. I'm like, okay. I'm always like, okay, here we go. Just turn to the left.
Because that would activate the SCM too, right?
And turn. You see, she can turn now. Let it go.
On your
Okay.
side.
Yeah, you work on the sternocleidomastoids. It's still a little spasming. I'm probably gonna work a little bit longer. And so I'm start stripping from all the way from that clavicle all the way up, and I bend to the side I've been working on. And look, it's not spasming anymore. We take that spasm away. Okay. Now this is really cool stuff. You come up here on that shoulder and neck, where's the start, the groove, and you put your thumb on C7, on that hump. And what you do, you gently turn to the side. She's already turning, and what I'm doing, I push straight this direction. And the head, people ask how far I have to turn her head. When you feel it's like start restricted, you just stay up there. You don't, like I said, we're not chiropractor. Yeah, and it just pushing this way. Take a deep breath and let it go. So we just with a breath. Doing okay?
Yeah, it's good.
She's doing good. Make sure it's. Are we doing this technique with if someone have a pin or rheumatoid arthritis in the neck or something like being broke? No, exactly. We don't do that stuff. We just work on the muscles. We don't do any movements. Okay, it's for the chiropractor and physical therapist. But yeah.
What about spinal surgery?
Spinal surgery, yes, it depends on spinal surgery, but we have to be really, really careful. Okay, let's see if we can go to the left. She can turn to the. You can turn to the right now. Yeah. Okay. No. Let her go. You see, we see when she turns, her shoulder is coming out. So that's where we have to work on those pecs muscle too. So no. Let her go. You see, we have difficulties to this side. She don't know how to turn.
Oh,
There we go. It just happened. So, and you always work, hold on, let me get the towel. So she's in the right, straight position. Her head, it have to be straight. You see, on one line, and I'm just applying my fist. I'm just applying my fist to that elevator scapula traps. Have to be like this. Here we go. You see this open, and I'm just hold that shoulder and push a little bit down, like 5-pound pressure, and I start scooping my fist down, and I'm kind of in the back posterior side of the shoulder and neck. So I kind of go to this T1, C7 area. And now a couple times, and now I ask you to shrug. Just shrug your shoulder a little bit, shrug. No. So
What's being
shoulder, come to your ear.
Oh, okay.
If people don't know, just let them know. Very light. And let it go and relax. Shrug again and relax. Very light. I'm not fighting here. I'm not doing any wrestling match. And this is, you do it. Here we go. Go ahead, try it. So, yeah, make sure your back is straight. Like this. There we go. Knuckle. Perfect. Yeah, good. Slowly. Just like, you see, I don't use any oil. How's it feel?
Look at that posture.
Yes, you're doing really good. That's, if you guys gonna do that body mechanic, you're always gonna save your back.
Go ahead and shrug.
Shrug, ask it to shrug. Very light shrug. Looks really great. And work on that hump. A lot of people have it. Like a lot of stuff going on. Yeah. Okay. So we can work on you. This is really easy. You come up here. You grab her head. You see my elbows come to my body. And what I'm doing, I ask her to turn, and she turned 45. And what I'm doing, I'm just apply my thumb and my index finger just under, and I'm pushing. How's it feel?
Good.
And try to rotate down. Try to rotate your head down towards the table. No, okay. So I ask her to rotate head back, and I resist
here?
it, and I resist it. Okay. Try turn really light. Yeah. And I found that spot. It just pops up right away. Turn again, and relax.
Oh, it's very painful.
Where? Under my finger?
Yeah, then I push it.
Of course, you activate this. Okay, come on, try it. So you grab that head, you come up here, always perpendicular, grab that elbow to your body, like this. Grab her head, turn to 45, like this, and ask her to just try to work a little bit. Just find that you feel that.
Yeah.
If you don't put on 45, you're just gonna slide away. But this 45 give you this angle. Hold it right there, and ask her to turn the head towards the table. Toward the table, and resist. And let it go. Perfect. This is kind of stuff you can work. Don't try to work a lot on the neck, maybe 15-20 minutes, and that should be done, because overdo can create more problem. Now what we're going to do, we're going to give her a little bit homework exercise, what she can do, and this is actually great. So go ahead and sit up and right this direction. Very slowly. She's not sit upright. That's okay. So what we're doing here, this is for you guys, you can do at home. This is all great exercise. So you put the towel on your neck, right behind it. One arm is coming right in here, and another one here too. And what I want you to do, and you pull your hands up and look up too. and pull yourself up and look up. Yes. So do this for at least like a 30 seconds. How did it feel? How's it feel?
Good.